staying with medical news this morning, early diagnosis of high blood pressure can be life-saving, particularly when it affects the arteries in the lungs and in the heart. We're going to go back now to the Corpus Christi Heart Clinic and Sunrise reporter Roland Rodriguez. And Roland, as we said earlier, this is not something that should be taken lightly.
Good morning, Mike, and good morning, South Texas. We are talking about pulmonary hypertension. This is not curable, but doctors say they can help you treat it and they can help you manage it.
Look at their heart function.
Pulmonary hypertension is a serious disease that can become progressively worse, even fatal, if not properly treated.
Pulmonary hypertension is a condition that's caused due to elevated blood pressure in the lungs. It's estimated that about 200,000 cases annually occur in the United States.
Doctors want to raise the awareness among those at risk of developing pulmonary hypertension and who might not be aware of the symptoms or the options for treating the disease.
Patients at risk of developing pulmonary hypertension can be those who already have established lung disease or heart disease. Patients can present with a number of symptoms such as fatigue, shortness of breath, chest pain, lightheadedness, or sometimes passing out spells.
Pulmonary hypertension is often underdiagnosed, and getting people correctly diagnosed is one of the reasons why the Corpus Christi Heart Clinic has started the first pulmonary hypertension clinic in Corpus Christi. This also means people with this condition don't have to travel to San Antonio, Houston, or Austin for treatments.
This is hugely valuable for our community. I have patients who have this diagnosis who can't travel distances, plus they don't have to travel for just medication changes.
After you are diagnosed with pulmonary hypertension, doctors at the Corpus Christi Heart Clinic will work with you to develop an appropriate treatment plan for your condition.
There are many patients out there who have elevated pulmonary artery pressures who don't get treated, are not screened properly. We have set up the whole program. We even have nitrous oxide testing in the cath lab. So someone who's got pulmonary hypertension will get the echocardiogram here, we'll get the 6-minute walk test here, we'll see a pulmonologist here. If needed, a cardiologist would be able to consult immediately.
And of course, we will have more information on pulmonary hypertension later this morning on our website at kristv.com. Now let's head back to the studio and check in with Mac and our morning weather. Mac.